Hey, everybody. Welcome to Dr. Tom's Tips on Tuesday at 10 in 10. There you go. I think, in 10. So today's topic is how to improve safety doing extractions with Isolite. So welcome, Dr. Hirsch. How the heck are you?
Hey, everybody. Good morning, Rolando. I'm terrific. How's everything at your end?
Very good. Very good. So what advice, what tips can you give our viewers and clinicians out there regarding Isolite and safety, using it for improving safety with extractions?
Okay, great subject to talk about because we all know that safety is paramount. Yes, we want to get the tooth out, but we want to do that in the least traumatic way as we possibly can, number one. And we want to make sure that the patient is safe, number two. We don't want to injure their tongue. We don't want them aspirating a tooth or swallowing a tooth or a burr or an instrument. So oftentimes these days, when I'm extracting a tooth, I'll section the thing. Let's say it's a posterior tooth, a bicuspid, a molar, or the multi-rooted tooth. I will go in there. I'll take this thing down to the gum line or just a couple of millimeters above the gum line with a 558 burr, and I'll cut this thing right off, just sectioning it horizontally with a 558 burr. Anybody ever had a 558 burr break or separate while you're doing this, or a quarter round burr break or number 4 round burr break or separate while you're doing this procedure? I have. Not often, but often enough that you don't know where the tip of that burr is going to go. Sometimes the tip of the burr will just stay lodged in the tooth section, and sometimes that thing flies off and it's going to Timbuktu. We don't know where this thing went. I have actually had it happen where the burrs come shooting out of the mouth at us, and I've had it happen where the thing has gone right down the patient's throat. Obviously, I wasn't using an Isolite, but it went back there. And you look at this thing, it was a quick, give me some cotton pliers. And you've got to say to the patient, don't move, hold really still. And they're kind of freaking out saying, what the hell's going on now? And then you've got to go back there, and hopefully there's not a lot of saliva where they feel like they have to swallow and this thing's going south. So the tip of the day is put the Isolite in the mouth to protect from any foreign objects being aspirated or swallowed. That can be a burr. That can be a portion of a root, That can be a portion of a porcelain crown. As we go in there and we're separating and removing the crown to get it off the tooth, porcelain chips and breaks, away it goes. So this happens more often than not when I'm doing something. More often than not, something will chip, something will break, and something will fall to the floor of the mouth. But I have gotten in the habit of utilizing the Isolite every single time I do an extraction. Now,
Awesome.
Yeah, so every time I do it, just for protection of anything going down the throat. And also the other nice thing is I don't cut cheeks and I don't cut tongues, because I'm going in there separating this. We've talked about this before. I don't cut the floor of the mouth. Only do it once. And I've said this before on a previous podcast. You don't want to do that ever. It's scary and bloody. So use it for protection. That's number one. And sometimes I've had clinicians call me up and ask me, you know what? I'm utilizing the Isolite, but it's in the way when I'm doing extractions. Let's say I'm coming from the lingual, and let's say I've got a Potts elevator or a straight elevator that I'm trying to come from the opposite side to get to that area, and I just can't get there because the Isolite's in my way. They say, do you have any suggestions? And I absolutely do have suggestions for when the Isolite is in the way. Number one, if you have to come from the lingual aspect with an elevator, a Potts or a Cryer or something like that, move the Isolite more distal. You can actually get this thing more distal by 1 or 2 teeth. So the farther back that you push the bite block on one side, the wider open they will be, but the more lateral working room and access you will have also. So that's number one. But when you're coming from the buccal surface or a buccal approach out here, and you've got to get the cheek retracted more when they're open wide,
right,
it doesn't stretch. But if they're closed down, you can stretch it out a lot further. So if you're coming from the buccal aspect, you can just pull the Isolite forward and still maintain this safety in the procedure that you're doing, because sometimes things just break. So the second tip of the day is move it more posteriorly if you need to for access, and then move it more anteriorly when you're coming from the buccal aspect. Now, along those same lines, the third tip would be this. Sometimes you just got to take it out of the mouth. I get it. So you take it out of the mouth to do whatever you're going to do. If you need a little bit more access for an elevation, you take it out of the mouth and then put it back in so that when something slips, it doesn't go down the throat. We've all had situations where we have the tooth in the forceps, like on a kid, for instance. You got this little dinky tiny tooth and it's in the forceps and the kid's moving all over the place and you got this thing and sometimes things slip. It's happened to me and it's happened to you. And if it hasn't happened to you yet, it will. Guaranteed it will. Murphy's Law, if it hasn't happened yet, it's going to happen. So be prepared for that because especially on a kid, you don't want this thing going down the hatch. And oftentimes we're doing multiple extractions and multiple quadrants. And this way you've got safety on the upper and lower on one side. And it just makes your job easier, number one. And it's peace of mind and safety that makes this really nice. So for kids and extractions, that's another tip.
Awesome. So here's what I got out of this so far. First of all, keeps anything from going down the throat, bar none. So it's helpful that not just teeth, but other components, right?
Yep.
Second, I love the point because we've heard that if clinicians are having difficulty with the elevators or the instruments trying to gain access, you can adjust that back and forth a whole bunch of different ways and either more distally or pull it more towards the anterior, and that'll give you the ability to kind of match them out. That was cool. Right. And then you also mentioned multiple extractions. So no worry, less stress. Anything else?
Yeah, there are. So let's say we're doing third molar extractions, and let's say you're doing just a wedge on the retromolar pad, and you want to expose the lower molar back there, and the cheek shield is coming across, cutting off the access to that area. Feel free to take a pair of scissors and trim as necessary. You got it in there. You can still have the tongue part retracted. And what's really cool is if you cut this just right, the actual cut part of the Isolite will go right into the tonsillar pillar area, still making a really good dam on the lingual aspect, so nothing can go lingually, but now allowing you to have more access on the buccal aspect of that tooth for your instruments if you're retracting a flap that way to take out a third molar. So that's another nice way to utilize this thing. Yeah.
Cool. And I almost forgot.
Be afraid to trim it. Many clinicians have told me sometimes it's in my way, and they get a pair of Crown and Bridge scissors and just trim it and take it out, trim it, put it right back in. Takes 2 or 3 seconds to do that.
And I almost forgot, you mentioned in the situations where especially you're dealing all the way back, you can always pull it out, but then put it back in because it's really easy to use. Right?
You can do that. And as you're doing this, when I'm sectioning teeth, and I section a lot of teeth that way, I got a lot of water going on. There's a lot of spray going on, and it's nice to have that vacuum in the Isolite sucking this out so it doesn't pool on the floor of the mouth. That's just a really nice thing to do. It frees up my assistant, so now my assistant doesn't have to retract the tongue or doesn't have to retract the cheek. She can really be in there with a surgical aspirating tip right at the area that I need her to be, and she can concentrate on the procedure rather than trying to concentrate on the tongue or the cheek or the floor of the mouth and vacuuming at the same time. So it frees her up, gives her an extra set of hands. I think I told you that.
Awesome. Well, hey, thank you so much. Really appreciate that. Yep. Hey, folks, if you like this content, please let us know. Please keep sending us information about things that you'd like to learn or issues you're facing or tips that you would like to hear from Dr. Hirsch so that when you're dealing with, especially if you're new to the system, you have the ability to do that. Thank you so much, Dr. Hirsch. Please.
And everybody remember, safety first. Be safe. Be safe with all this COVID stuff. Wear your mask. Keep your social distancing. Be safe. But be safe when you're working in the mouth too.
Awesome. Have a great week. We will see you next week with Dr. Tom's tips at 10 in 10. If you like this content, please share.
Tom's Terrific Tips Tuesday at 10.
All right.
Tomorrow.
All right. We'll talk to you later.
Whatever.
Thank you.
Thanks, everybody. Thanks, Rolando. Bye, everybody. Have a great day.